there's a growing shift in the fight against the pandemic.
More states, including California and New Jersey, are pulling back on their mask mandates as daily COVID cases drop.
UW Health Chief Quality Officer Dr. Jeff Pothof is back with us on this Tuesday, as he is every week. Good to see you again,
Hi, Dr. Pothof. Good to see you.
Good to see both of you.
So where do things stand with Omicron here in Dane County?
Yeah, cases are dropping. We still have Omicron around. I mean, we're at pretty high peaks. So even with the drop that we've seen, there's still a healthy amount of Omicron in the community. But if that trajectory holds, we could be in pretty good shape in the next, 2 to 4 weeks.
Well, cases, I think I was looking, are down about 30% in the last 2 weeks after the peak in January of the Omicron variant. And given what some other governors are doing, this is not a political question, but do you think it's time maybe to ease up on some of the masking restrictions?
I think we'll let data drive that decision, just like we've made other decisions during the pandemic. To take away masking kind of mandates or recommendations, what you really want to see is about 50 or less per 100,000 cases per day, people per day. And then you want to see that percent positivity to drop, under 8% or so. Once you get to that level, the prevalence of the disease is low enough where, the likelihood of coming in contact with someone who has COVID is so low that the masks don't offer as much benefit as they do when those cases are much higher. So we could get there in the next, few weeks.
I hate to be glass half empty, but there could be another variant down the road.
Yeah, I think this is the thing that we all hope doesn't come true. Right now, there isn't anything on the radar that's imminent, but it's possible that there could be a variant that is more contagious and different enough structurally from Omicron that we do see another spike. We can't completely exclude it, but I do feel, at least for the short term, things are looking pretty positive.
Oh, that's good to hear. How are things on the testing front? Has the pressure eased up a little bit in terms of getting test results back?
Yeah, I think it's a bit better just because there are less people seeking out tests because there's less COVID-19 in our community. So I haven't heard recently issues with getting testing done, whether PCR. Access to antigen tests can still be a little bit tricky, but not as bad as it was. And people are starting to get their 4 free tests from the government, which increases the supply in the community too. So not the same situation as it was just a few short weeks ago where it was really hard to find a test.
Well, can I ask you an anecdote, though, that we got from a coworker, because I'm sure there are people watching that have had this same experience. One of our coworkers, his girlfriend tested positive on a rapid test 5 days in a row. She tested positive. Then she had 2 PCR tests, and the rapid tests were negative. The PCR test was positive, both of them. So is that why they're calling this Omicron variant the stealth variant? Could this be that BA1 or BA2 we were talking about?
Yeah, this scenario is out there, and it actually isn't why they call the BA2 subvariant the stealth variant. It's complicated, but they call it the stealth variant because in some labs, and none really here, when they try to figure out which variant you have, there's a certain way you can do a PCR test to figure that out, and the BA2 subvariant doesn't show up there. Here in the local area, and most labs in the United States, we don't use PCR to do the variant subtyping. For the most part, that BA2 will show up on any of the PCR tests that people can find in this Dane County area.
And so the home tests are not necessarily that accurate.
They're less accurate. I think the benefit of the home test is if they're positive. The antigen test, there's a lot of reasons why it could give you a negative result when in fact you're positive, how you collect the sample, where you are in the course of your disease. But where they do shine is if you're having some symptoms and you take that home test and it's positive, the likelihood of you actually having COVID at that point is really high.
All right. Well, fingers crossed that we keep going in the right direction.
I hope so.
Doctor, thanks for being with us. We'll see you next week.
Thank you, Dr. Pothof. We appreciate your time.